Good morning, Trinidad and Tobago. The pleasure is once again mine to welcome you to the Ministry of Health's COVID-19 update for Monday, 17 January 2022, where we provide you with accurate and up-to-date information on the national COVID-19 response. Your presenters today are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and Dr. Avery Hinds, Technical Director, Epidemiology Division, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's conference. We begin with the CMO, who will present the latest clinical update on the parallel healthcare system. CMO.
Hi, good morning. Thank you, Mr. Alexander. Good morning to the Honorable Minister. Good morning to Dr. Hinds, members of the media, members of the viewing and listening public. So if I could have the first slide, which is the update for the 16th of January 2022. We begin on the top with the fully vaccinated numbers, 48.5 in purple on that right-hand top corner, and that is further broken down into fully vaccinated in light green, and on blue on the right-hand side, not fully vaccinated, meaning first dose or no doses. So in terms of fully vaccinated, 679,498, and I think Minister will give the updated figure as of late yesterday evening. Our unvaccinated cohort, not fully vaccinated, 720,502. Boosted administered so far, 99,476. New positive cases reported over the last 24 hours, 404. Deaths reported over the last 24 hours, 17, and condolences to the families of all of those persons. Total active positive cases now stand at 16,519, and those are including the home isolation cases, which I'll go into a little detail further on. Total patients in hospital so far, 610, including both step-down and hospitalized patients. And this broken down in terms of patients' vaccination status in hospital and step-down during the period July 22nd to December 29th. Fully vaccinated, 1,727. Not fully vaccinated, 10,227, the lion's share. And again, deaths on the bottom, if you look at vaccination status as of 12th of January 2022. We're looking at the small green segment, 177 are those who would have been fully vaccinated at the time, and not fully vaccinated, dark blue, 2,552. As we said before, the gray section, 390, relates to those deaths who were in persons unvaccinated as well, but occurred prior to 24th of May when we had our first cohort of fully vaccinated people in the country. So in terms of the clinical update, that is my short presentation this morning. Back to you, Al.
Thank you very much, CMO. And Dr. Hinds will now present the latest epidemiological update. Dr. Hinds.
Thank you, Mr. Alexander. Good morning to the Minister. Good morning to the Chief Medical Officer, Dr. Parasram. Good morning to members of the media and members of the viewing and listening public. If we can go straight to the first epi slide, we will see that we're looking at a period that spans the end of July into the start of August of 2020 and continues from there all the way to January of 2022. On that left-hand side, we see the first little rise or hump in that particular graph representing the rise of the first wave of community transmission that we would have seen back in August of 2020. And whereas at that point in time, we thought that those figures were actually quite high, in retrospect, now we realize how small those figures really could be based on what happened subsequently as we got new variants introduced one by one into the population. So that gray bar with that small rise at the left-hand side, or that gray area with the small rise on the left-hand side, represents that first sort of July-August surge, and then a return to low numbers into January and February, and then that small increase that began to expand and to multiply between mid-March, early April, all the way into May, which corresponded with a few things, including the introduction of the Gamma variant, which is a little more transmissible than what was originally circulating. If you look at that gold area in the middle of this graph, that corresponds to May, around the time when we implemented several very stringent measures to reduce movement and mobility and interaction, and hopefully to reduce spread. And we did see that that had a useful effect in that the numbers then began to decline. So the gold bars began to get shorter again. We saw May into June, June being the blue bars, seeing declining numbers day to day. And then we began to do certain relaxations. We began to relax some of the restrictions, allow additional movement, and we saw that the numbers then stopped going down and basically plateaued for a period. And that period included July, which is the pink section, August, which is the blue, September, which is that brownish sort of color, October, which is the light green. And in October, we noted that we were beginning to see again indications of slow increase and a big jump into November. And again, this corresponded to now the introduction of the much more transmissible Delta variant around that time period, which showed itself in another surge in transmission. And that carried all the way over into December, which is the red bars. And we're seeing slightly shorter bars, slightly lower numbers in the lighter green over to the right-hand side for January. But we are making this entire comparison against the backdrop of the continuing looming threat of the introduction of yet another variant, which is even more transmissible, which is the Omicron variant. So we want to point out that as we get new variants, we tend to see this sort of surge, and we want to ensure that we do everything possible to reduce the risk of that, because the larger the surge, the larger number of new positives that we get, the greater the strain is on the healthcare system, the larger the risk is of having individuals pass on. And this is what we try to avoid with the public health measures, which include the hand washing, the physical distancing, the mask wearing, and most importantly, the vaccinations. If we move to the next slide, we see the same data, but now at a weekly level of aggregation. And for this slide, the time period is really just the start of 2021, so January 2021 into 2022. And the same colors for the months. You recognize that that gold area, which is the May spike, is now the highest bit of the first half of the year, when we just had the Gamma variant in circulation, the plateau as we mentioned before, and then those increases week by week into November, December, which corresponded to the introduction and then wider dissemination of that Delta variant. We've been pointing out that the last week in December had a shorter bar, meaning a lower cumulative number, largely because of health-seeking behavior around that time. So that the rebound that we're seeing in January doesn't correspond so much to an increase in the rates just yet, but it really corresponds to a rebound in sort of what were the baseline rates or numbers for that time period. So we haven't yet seen that the beginnings of the increase that we're bracing for with regard to the Omicron variant, but we continue to advise the population to brace, because we do know that we've seen in other jurisdictions the kind of havoc that that very rapidly transmissible variant has wrought upon much bigger health systems. If we move to the next slide, you basically see this data, but now in a tabular format, where we look at the sort of percentage changes between one week and the next. So that last week of December, which was Epi week 52, over on the bottom left of that table, that last week is where we saw a big-ish drop of a 37.9%. But as we said, that's more health-seeking behaviors, so that the rebound we saw to 53% increase between week 52 and Epi week 1 of 2022 wasn't really a rise or a surge, but just a return to what was the background or baseline sort of numbers that we were seeing in that time period. And we've seen that from Epi week 1 to Epi week 2, there was a little less of a massive decrease. So we saw really just 7.3% drop from Epi week 1 to 2. We are currently in Epi week 3, which began yesterday, the 16th, and we have only 1 day's worth of data for that so far. And as this week progresses, we will see whether we are going to equal, fall below, or surpass the total for Epi week 2. So we'll see if that downward trend continues as we move forward. If we look at that, if we look at the next slide, same data at a monthly time scale, We now are looking again at January to January, so January 2021 to January 2022. And if we look at the actual heights of the bars there and the numbers above them, we see that December for 2021 was so far our record-breaking month with well in excess of 20,000 cases for that month alone. And as we progress through January, we see the first hopeful landmark that we haven't quite halved that, and we have halved the month of January so far, reached the middle of January. So we are hoping that we see a smaller total as we go forward, because these new cases, as they turn up, tend to, for want of a better word, their effect when they turn up on a given day extends several weeks into the future. As they remain active cases, they may need hospitalization, and that impact on the health system will be multiplied if we have much larger numbers of new cases suddenly beginning to appear and accrue. Moving to the next slide, we look at the demographic distribution, which has remained fairly steady throughout the phase of community transmission. We've seen just about equal proportions of men and women throughout being infected, and the largest numbers, the longest bars, are in that age range between 25 and about 49. And that corresponds to the young, healthy, mobile age group of individuals. And this also corresponds, unfortunately, to an age group that hasn't yet really sought vaccination to the levels that would help it or protect it as much as is possible. So while we did have increases in vaccination uptake in the older population who was targeted first, the population that had comorbidities, and they took that vaccination opportunity seriously, we still do find that in the younger age groups that coverage for vaccination isn't optimal yet, but the vaccines are available. And we do want to continue to encourage all individuals who can be vaccinated to go ahead and to do so. When we move to the next slide, we see the demographics for the COVID fatalities. And there are a few things that we keep pointing out here that, of course, bear repetition. While the male-female balance is a little different, it's a little skewed in favor of the males, about 57% men among the fatalities. We also note that the individuals who pass are, in the most part, those individuals over 60, so about 2/3 of the fatalities. But there is a significant number of individuals below 60, that 1/3 is not to be ignored, that also have had fatal COVID outcomes. One of the things that we keep speaking about is the fact that several comorbidities are frequently in play. And when we say comorbidities, we mean the pre-existing chronic diseases that individuals may have: diabetes, hypertension, kidney disease, treatment for cancer, all of these things that increase your risk of having an adverse outcome. And as we moved forward, as we vaccinated, as we looked at the numbers, we've seen that the ones who continue to have fatal outcomes are, for the most part, those who are the unvaccinated. And we do want to make a very special plea to everyone to take up the opportunity to be vaccinated, because it is making a difference in terms of reducing your risk of fatal outcomes. If we move to the next slide, we'll see what we mean. So we're now going to compare the rates of fatalities using that January 12th update that we had spoken about, and which we keep referencing at the bottom of the dashboard. So that short green bar at the bottom of the dashboard representing the vaccinated individuals among the total deaths. That shows the 177 deaths that would have occurred among what's deemed fully vaccinated people in that time frame. And if you compare that with the total population of fully vaccinated individuals, and you get a rate, you'll see that that rate is actually much lower than the rate if you compare the over 2,500 deaths among the vaccinated individuals with among the unvaccinated individuals with the unvaccinated population. In fact, when we go into that calculation in detail on the next slide, what we actually noted was that there was a 15.6-fold increase compared to the vaccinated. So those individuals who were unvaccinated had a death rate that was 15.6 times higher. So there were about 40.69 deaths for every 10,000 unvaccinated individuals. And when you compare that with the vaccinated individuals, there were 2.61 deaths for every 10,000 vaccinated individuals. So that rate of death among the unvaccinated is significantly higher. If you want to look at it a different way, we can move to the next slide and look at what we call risk reduction. So whereas the reduction in risk among those who are vaccinated showed about a 93% or 93.6% risk reduction, that was not afforded to those who did not take up the opportunity to vaccinate. And it means that if you look at the number of deaths that occurred among the unvaccinated since vaccination was a possibility, we could have presented more than 2,300, nearly 2,400 of those deaths if that same 93.6% risk reduction was applied to that population. So the vaccination has made a difference and could have made a much bigger difference if it were more avidly taken up. So we really want to drive the point home that in spite of the misinformation that may be circulating, if you look at the global data and then you look at our local data, we see that there's a correspondence. There's a very similar sort of pattern where those who are vaccinated have over 90% reduction in their risk of dying from COVID-19. We have a 93.6% risk reduction at this point in time. Other countries have seen 94, 95. But the point that we're making is that the vaccines are saving lives. They've been saving lives locally. They've been saving lives internationally. And we do want to encourage everyone who can be vaccinated to go out and do so before we get to the point where we again have large circulating numbers of infected individuals and surges in numbers because of the introduction of the Omicron variant. Because you really want to protect yourself and those around you as much as possible in advance of an oncoming surge. So with that, I'm going to wrap it up and turn you back over to Mr. Alexander.
Thank you very much, Dr. Hinds. And now we go back to the CMO, who will provide us with some additional statistics on the parallel healthcare system.
Thank you. So I think there was some technical issues with the slides. So if we could have the first slide for the second presentation, which begins with the Trinidad and Tobago active cases in the community. Yeah, that one. So thank you for putting it up. That we've been doing this from time to time, maybe every month or so, and presenting the data for the population. What jumps out at me straight away is that you see Victoria is at 41.4% of the active cases in the community, which is quite a large number. What we have seen traditionally over the last year or two is that County Caroni and Victoria, at least for the last 6 months or a year, have been sharing 25%, 23% respectively. But now we're seeing a great preponderance of the cases in Victoria, 41.4%, Caroni at 14.5%, the lowest county that we have here, St. Andrews, St. David, 1.7%, Neriva, Mayaro, lower number of cases as well, 2.5%. In Tobago, we see 9.2, which is a little bit higher than we expected for Tobago at this point in time, but it still decreased from a couple weeks ago when it was a little bit higher in terms of percent. So if you could go to the next slide, please. So home isolation, patients' clinical disposition in the second slide will show basically symptomatic disease, again 49% of those who are at home at this point in time, asymptomatic 47.1%, recovery is 3.8%, and transferred to facilities 0.1%. Next slide will show, if you could go forward, the comorbidities breakdown for Trinidad. We see again, as we have seen throughout the epidemic, diabetes and hypertension forming the greatest portion of our comorbidities in the cases. So 28.6% for diabetes, 37.7% for hypertension, asthma 16.1%. If you look at asthma, diabetes and hypertension together, they contribute 82.4% of the comorbidities in this particular group. The others play a much smaller role. Heart disease 3.5, pulmonary issues 0.3, immunodeficiencies at 0.5, other at 9.7, and of course pregnancy is not a comorbidity, but it predisposes you to complications of COVID-19. Next slide. So the next slide shows a breakdown of those with comorbidities and without. On the darker teal, you find 52.1% of those with comorbidities and 47.9% without. And this is more or less what we have been seeing across that period of time described earlier. Next slide will just show, go forward, to the age distribution for this particular group. Just to highlight, the over 60s and what Dr. Hinds has said, we noticed 2/3 of the fatalities occurring in the over 60s in Trinidad and Tobago. And it's still worrying to see the infections occurring within this group. So we have 38.44% of infections as of this point occurring in that age group. And we see that as a very high risk group. We want to try to get the amount of infection occurring there to a minimum, and of course having those people vaccinated as soon as we can. The other big category, 20 to 59, accounting for 56.58, and the under 19s only 4.99%. We have to bear in mind with the under 19s as well. There is usually, especially with Delta and the other variants that came before, there's a tendency to have a lot of asymptomatic spread with mild disease. So you wouldn't pick them up as cases, but they can be a vehicle where you have spread of disease quite readily. The last slide basically gives, if you could go to the last slide, it will give basically patient distribution by age, by sex, sorry, and again it's similar to what Dr. Hinds is seeing for the national picture. Male at 46.6 and female at 53.4. So that brings me to the end of the clinical update, Mr. Alexander.
Thank you very much, CMO. I now hand you over to Minister Diasing, who will update us on the vaccination figures and other pressing issues concerning the COVID-19 campaign.
Thank you very much, Al. Good morning to the CMO, Dr. Hinds, ladies and gentlemen of the media, and the viewing and listening public, wherever you are. Pleasure to be here at the start of another week. So our vaccination figures, unfortunately, as I indicated on Saturday, have taken a very deep dive. We are, as of last night, 679,532 persons have finished their vaccination regime, which is 48.5% of the population. We seem to be stuck on 48.5 for a few days now. Total number of boosters, 99,602. Of concern is the 12 to 18 cohort. There are approximately 90,000 persons in that cohort in school, and probably another 10,000 maybe out of school. To date, only 51,751 persons in that 12 to 18 cohort, which represents about 56% of that cohort, are vaccinated. That is a particular concern because, as you know, we want children back out to school. Some will be taking public transport, mingling, mixing, and we want children back out to school. I'm appealing to parents because the information we are getting is many of these children want to be vaccinated now, but many parents are preventing them, and we can't do that without parental consent. I just want to make an appeal to let the public know, as we have said publicly on several times, that our current stock of Pfizer vaccines will expire at the end of February 2022. So basically, for that 12 to 18 or anyone else who at this time wishes to access the Pfizer vaccine, you have a month and a half to do so because our current stock is expiring at the end of February 2022. We are in the marketplace to get additional stocks with better expiry dates, but that is not a guarantee at this point in time. The total number of pregnant women, the pregnant population is of particular concern again, and we are urging the pregnant population. You have heard Dr. Surgery Singh here pleading with pregnant women. Only 675 have been fully vaccinated. And again, that is with Pfizer because that has been approved for pregnant women CMO. So again, for the pregnant population, if you are considering being vaccinated, you have a month and a half to access the Pfizer vaccines. I took a drive by the paddock on my way here, and I got reports from the stadium. There is no line. There's very, very little people seeking vaccines this morning. That is very concerning to us. We urge people, and as the CMO said, the over 60s who are disproportionately dying with your comorbidities to start to get vaccinated, get boosted, and be careful with the three W's. We want you around. So as far as humanly possible, let's that other 52% of the population that is not vaccinated, please come out and get vaccinated. The benefits of vaccines are undisputed. Thank you very much, Al, and now we could take some questions.
Thank you, Minister. And as we move into the question and answer segment of this conference, we want to remind our media representatives to indicate their name and the name of the media house that they represent before posing their two brief questions. Kindly indicate to which presenter each of your questions will be posed. And of course, if time permits, we will field an additional question from each media representative. We will start this morning with azpnews.com.
Good morning, Private Harry, azpnews.com. Good morning. Well, my first question is for the CMO, and my second question is for Al. CMO, I want to get an update on the children who have been in hospital, and I know that one of them was in ICU. Is that child still in ICU? Thank you. And Al, there have been reports of one patient who passed away at the Arima Hospital, and his relative has said that they have not received his cell phone and his wallet with money in it, and they said they are claiming that it has been stolen. And I know they have spoken to you about it. So I just wanted an update into that situation. Thank you very much.
Thank you very much. In respect to that information was passed on to respective RHA, and I know that they were treating with it. Second question.
Okay. Yeah, so the pediatric update, I think, has remained the same. I didn't get the figures for this morning as yet in terms of the actual patients in hospital. So I'm awaiting that. Should be sent to me soon from Dr. Richards, and we'll be able to confirm that information for you prior.
Thank you very much. And we move on to our second person, 103.1 FM. We're ready for your questions.
Hi, good morning. Rai Rikomas from 103.1 FM. Can you tell us how many people have been caught or charged for breaking quarantine or isolation while COVID positive? That's my only question.
So there have been a number of cases over the span of the last few years that we did report to the police. I don't have a number of the police will be in a better position to say how much or how many of these people would have been. I don't want to use the word charged loosely. The whole prosecution and the investigation would have been completed. So we would have reported quite a number of persons who would have been, in our view, in breach to the TTPS, and we do have a focal point that we deal with directly, all the CMOHs and myself, and that process continues.
Thank you very much, CMO. We now go to Guardian Media Limited.
Hello, morning everyone. Rashad Khan here from Guardian Media Limited. Okay, so my first question is for Dr. Hinds. Dr. Hinds, over the past few weeks, we would have seen a number of Omicron cases, and quite a bit of those would have had no traces, essentially, of source of infection. Have we found out through epidemiological investigation any of these cases that were unknown at the time? Have we found out what their source of infection was, and what is the metric being used to declare it as community spread? And my second question is for Minister Dialsingh. Minister Dialsingh, we've been speaking for some time now about home test kits. And some people from the population are wondering, is it okay now, seeing as we've gotten some approvals to go and purchase these from pharmacies? Are pharmacies allowed to sell it? And within that, what is being done to ensure that the kits that are being sold are the ones that have been approved by the ministry?
Thanks. Okay, so I'll take the second part first. So We did put out a detailed press release um, saying which kits are approved, so the public is aware of which kits are approved. In that release, there was also a phone number that any member of the public could call to report the sale or purchase of any kits that are not approved. So we need the public's, and I'm glad you raised it. The public is now fully aware and advised. We also work with the pharmacy board on these issues to make sure that what is available for sale are kits that have been approved by the Chemistry, Food and Drugs Division. Okay, so that is what we do. And again, we urge the public to be vigilant. And there are numbers you can call as we put it out there, and it's on the Ministry of Health's website. If anyone is unsure about the suitability of any rapid antigen test kit. Thank you very much, Rashad.
Okay, thank you for the first question. With respect to the cases of Omicron, or the Omicron variant that have been detected so far, what we've seen as we've moved from the first batch through to this most recent batch is that there has been something of an increase in the proportion of those that didn't have a link to travel or a connection with someone who had traveled. So in this last batch of 6, we've seen that 4 of the individuals who had been contacted and for whom the investigation had been completed didn't actually have a link to travel that they were aware of. A couple of them did have contact with other individuals who had flu-like symptoms, and the investigation is going on as to whether or not there was a travel history with those individuals. So as we are continuing the epidemiologic investigations and the observation of what's going on in the population, we are seeing where there are increasing proportions of these cases that don't seem to be linked to importation and are therefore likely linked to what we call hidden chains of transmission. As we continue to uncover these chains, we will get a better idea of how well established these are, if they are self-limiting. Because what we do attempt to do when we discover any chain of that nature is we attempt to reach out and sort of cordon. So we would try to isolate those who were in contact and also to quarantine those who are not yet positive but may have been exposed to limit the spread of those chains. So while we continue to do that and we don't see evidence of multiple chains popping up all over the population, then we don't yet say that we have established what's known as community transmission. But we are aware that this is basically an imminent threat. We've seen it happen in other populations, and as we continue to do our investigations and observations, we will not be surprised to see it happen here, but we are doing everything within our public health capability to delay it as far as possible by implementing all of the public health measures around the Omicron cases that we do identify. So as that situation evolves, of course, the population will be kept updated.
And let me just make a plug for boosters. I think Dr. Hinds, the evidence around the world shows that one of the best protection against the Omicron variant is that third shot.
Yes.
Right? So let's get boosted. Thanks.
And with that, we move to Newsday. We're ready for your questions.
Good morning, everyone. Rihanna McKenzie here from Newsday. My first question is for either the CMO or for Dr. Hinds. Are there delays in getting test results given the number of cases that we are experiencing? Members of the public have reached out to us and indicated that they are waiting a long time. In one case, someone whose 2-week quarantine ended and they never received a result. So what's the update there? My second question is for Minister Dayal Singh. Did the ministry consult with tour operators regarding the resumption of tours using the Carney Swamp as an example? Their tour hours are usually 4 to 6. That's usually when the Scarlet Ibis comes out. So were tour operators consulted when determining the opening hours for rivers and beaches, etc., or will swamps be given an exemption to operate within their usual hours? Thank you.
So I'll take the issue of tour operators. The tour operators for both Buko and the swamp, the Carney Swamp, would have reached out to us. In the case of the swamp, they would have wanted it for educational purposes. We considered all angles of this, And we decided that as we are opening up more and more things, what degree of risk can we take? And we felt at this time, given the Omicron variant, given the burden of the TTPS to monitor and manage all of these things, we will go for both activities between the hours of 5 a.m. and 2 p.m. It is not a static position. We understand all of the concerns, but let us learn from other countries that did things too quickly and then had to reverse. I understand the concerns, and yes, both did write to us, and we did respond in writing. So that is where we are at this point in time. But it's a moving target, and let's all just have a little bit of patience as we open up more and more things and take more and more risk. Okay, thank you very much.
Yeah, in terms of the delays, and we have noted this in the past, whenever there's a significant surge, you tend to have some lag time in certain instances in terms of the laboratory results getting back to patients. The CMOHs who are responsible for contact tracing are also responsible for disseminating those results. And if I can have that particular case off the record, I can look into it. But just to say for the general public, we do have an email that was set up last year to try to manage a little better. So it's COVID-19 results at health.gov.tt. Just to repeat, COVID-19 results at health.gov.tt, which is actually placed and under the coverage of the Trinidad and Tobago Public Health Lab. So the director has assured me that she can turn around at least a response to those individuals if you email to us within 24 to 48 hours. Also, we have been working assiduously through the DPS at the ministry to get our hotline working as well, so people can call in through the hotline if you're looking for those kinds of results as well. So those are the two avenues that persons can have for this particular individual. As I said, if you can get the name off the record, we can look into it personally as well.
Thank you, CMO and Minister. We go now to TV6. We're ready for your two questions.
Good morning, Vanessa Cutting, TV6 News. I just want to add on to that issue of the reporting, because it's actually not just an issue of a lag in reporting, but also processing, because I myself would have gotten tested and some friends 2 weeks ago. I waited 1 week and I sent an email and I was told that the results are still processing. So if we could really get a quantitative idea of how far behind we are in terms of days in testing, that would really be appreciated. I still haven't gotten the results, by the way, but my quarantine is ending. My questions are, to what extent does the ministry feel that the recent claims made in the public domain of severe adverse events following COVID vaccination, to what extent does the ministry feel that that is further impacting on parents' decision not to have their children vaccinated even as school is reopening? And also, if you could have an update, some specifics into those investigations. Has the ministry been able to confirm that they were legitimately vaccinated, and where are we in that process?
So if I could start with just which led up in terms of the delay, it varies. Again, it depends. It's not a one point in the system in terms of reporting alone. The number of tests coming into us, we have testing capacity at all the RHAs, including the Trinidad Public Health Lab, as well as the Medical Research Foundation, has been assisting us with our testing in terms of trying to clear just the sheer numbers that we're getting into the system. And we're working with the Trinidad Public Health Lab as best as we can. She's working, the director, with all of the RHAs in the event that there are issues, so that she can try to clear that backlog as best as she can. In terms of the question related to the adverse events, again, when we reported upstream, we would have reported less than 10 adverse events reported to the Ministry of Health out of over 1 million vaccines plus that was given. So a very small proportion. We are in the process through the manager of the EPI, based on the names that we saw in the public domain, looking at those persons to see if any of those reports were made to us. There's one such report out of the individuals, and those persons will be referred to the respective RHA to ensure treatment is given as appropriate. So that is where we are in terms of the investigation.
Thank you very much, CMO. We go back to azpnews.com for a follow-up question.
Good morning again. Thank you all. Minister, the Chemistry, Food and Drug Lab um, has been done for some time. So how are these rapid antigen tests being approved and tested by the Chemistry, Food and Drug Division? Thank you.
So we're talking about two different things. The actual approval is looking at quality in terms of the documentation that is sent, the technical dossier that is sent to the Chemistry, Food and Drug Department. So they have a role in terms of determining the quality of the test based on the dossiers that are sent into them. We also have other reference labs through the Caribbean Public Health Agency that can do quality assurance work, and we have those labs that assist us greatly throughout the pandemic and even before as it relates to quality assurance. So we have been relying on those individuals as well.
Thank you, CMO. Guardian Media Limited, we're ready for your follow-up question.
All right, thank you all. My question is, the panel. We've received complaints of some relatives of COVID-19 patients claiming that the relative would have gone into the hospital, the traditional hospital, for other treatments and would have contracted the disease while there. I mean, is this a phenomenon that we have documented as occurring previously? And is anything going to be done if that is the case?
Right. So generally speaking, we have protocols in place where most people in most hospitals in Trinidad and Tobago, persons are swabbed prior to going into the hospital. Now, we haven't stopped visitation altogether. It is not a closed environment where there's no one coming in and no one going out. There are relatives that come in and visit as well. There's staff that go home and come back into service. So there's a movement inside a ward. There have been instances where we did have, and we reported to the public, cases occurring in terms of different wards throughout the pandemic within the non-parallel system, and that has been what we have done is looked at the infection prevention control mechanisms, gotten the microbiologists in those instances to see where there would have been breaches in terms of the chain, and it would have been strengthened as best as we can. But we're really asking persons, especially coming from the outside, if you do have signs and symptoms suggestive of COVID-19, that you don't go into that sort of facility. Generally, when you have a hospital environment, you have ill people, of course. We don't want them to be exposed to anything else. And our staff as well have been very vigilant in terms of getting their vaccine, first of all, and then, of course, following out the IPC guidelines as best as they can to ensure we don't bring nosocomial infections into the mix of it in the non-parallel system.
Yes, Rashad, and let me just say as a policy guideline that we started very early in the pandemic, coming out of my office, was that we advised all the RHAs that prior to the pandemic, I think there were 2 visitation periods of 2 hours each. And then because of that, and to prevent exactly what you were asking about, we had limited that to 1 visitation period of 1 hour with 1 person. So 1 person, 1 hour, can go in and visit, take whatever messages you want, whatever you want, but it's not a sterile, perfect system across the globe. This is common across the world. The only way to prevent that is to lock off everything, which is physically impossible. So we have implemented our mitigation strategies, but one of the best mitigation strategies is vaccination. Right? Thank you very much, Rashad.
Thank you, Minister. TV6, we're ready for your follow-up question.
I have one follow-up question from a member of the public, but I just also want to get a point of clarity on the answer that was provided to my previous question. CMO, you would have indicated that you had received 1 report and that you all are following up on that. Is it that all these persons need to file reports, official reports, in order to have their claims investigated? The question from the member of the public is asking, if you have a family plot in a cemetery and you have a relative who passed from COVID-19, could you have the person buried there, especially where the designated cemeteries have already, the designated COVID burial areas are already at capacity?
Yeah, so your first question as it relates to filing of the reports, generally speaking, our system picks up persons that come into the system, haven't been vaccinated, for example, and presenting with a symptom, and on history, these clinicians find that there is a temporal relationship. They report that upstream through the manager of the EPI, as well as sometimes the Dr. Hinds' unit in parallel. So that's how we normally get our reports. If people are getting signs and symptoms and they suspect it would be, the best way to go forward is to move into the health system. So you see either your private physician or your public sector physician, and then they can do that assessment and make a determination. The second question, I have been written on that matter from the regional corporation, the principal medical officer in that particular division, and my legal advisor has advised that within the law, they have the remit and they have the public health expertise to conduct those assessments and make a determination. So that generally falls within the local government sector, and they have been advised of that. Again, Ministry of Health always retains some overall or overarching responsibility, but for that particular issue, local government has been dealing with it.
Thank you very much, CMO. Richard, I see your hand up. You ready for your question?
Yes. All right. Thank you very much, Al. CMO, I just want to follow up to that response you would have given to TV6 a little while ago. That one case of an adverse reaction that you would have said that is being treated at hospital, is it possible that you could go into a little bit more details about it? And I'm only saying that because we've had some wild claims in the past about adverse reactions, and I just want to know if any of those are the ones that is being treated.
Richard, I don't think I could go into detail really because of patient confidentiality. Having said that, the reports come to us so that we see there may be a temporal relationship with a particular illness, but it does not give causality, one, and it really is the responsibility of the clinicians and the RHA to investigate that further. So at the ministry, we are flagged, and we flagged to the respective RHA for them to continue the investigations.
Thank you very much, CMO. And as there are no more questions, we have come to the end of today's virtual media conference. Thank you for tuning in this morning. And please remember that the COVID-19 vaccine remains an essential tool in the global fight against COVID-19. The COVID-19 vaccines being distributed by the Ministry of Health are all WHO approved. They are safe, they are effective, and they are free. For the unvaccinated friends and relatives, co-workers, you now have a number of options available to you. Please don't hesitate. Do it for your family, your friends, and your country. We leave you with 2 short videos of persons just like you and I who did their part and got vaccinated. So let's all do our part. Let's vaccinate TNT. Goodbye for now.
We are here today as a family who came to get vaccinated because it's important, I believe, to be vaccinated. I am a daycare provider. I took the opportunity to invite my niece to come with her son because she also deals with children. And at first we had our hesitancy, of course, because there were so many things in the air about the vaccine. We decided to put our faith and trust God, and we prayed about it, and we came today and we took the vaccine.
My name is Josiah Westclair, 17 years old. I took the vaccine because I like to go back out to school and with my friends.
Hey, yo,